I am briefly explaining tests to the patient. Do you understand English?
Yes.
Thank you. Now I am giving you one object in your hand and you have to identify what it is. Have you understood?
Yes.
Is it clear?
Yes. Yes.
See, you have to always communicate with the patient. Have you understood? Is it clear? Close your eyes. Now close your face. Yes. Can you identify this?
Yes.
What is it?
Spoon.
Yes, this is a test for stereognosis. Can you repeat what is it loudly?
Spoon. Spoon.
I have already shown you what is stereognosis in living anatomy demonstration. Yes, examiner may ask you to demonstrate. What he can ask you to demonstrate? Yes, stereognosis. Then he may ask you to demonstrate 2 points discrimination. Of course, I shall teach you 2 point discrimination later. Now, what is stereognosis? There is short answer question or viva question on stereognosis. Of course, we are studying parietal lobe and neuroanatomy. So, what is stereognosis? Stereognosis is ability to perceive and recognize. I'm repeating two words twice. Perceive and recognize. I'm a bit slow. Stereognosis is ability to perceive and recognize the object. I'm repeating again because definition has to be clear. Stereognosis is ability to perceive and recognize the object. Now what happens in stereognosis? What is a pathway? It is called as dorsal column medial lemniscus pathway, DCML, dorsal column medial lemniscus pathway. It is ending here. This is central sulcus, this is post central gyrus, this is end point. Now where is the beginning? Rather we call decussation. So decussation is from medial lemniscus to this area, that is called sensory cortex. So decussation to area, that is from medial lemniscus, look at me, medial lemniscus to post central gyrus via medulla, thalamus. You may write ventral nucleus or you may not write ventral nucleus. Just remember these words: spinal cord, medulla, thalamus, internal capsule, and finally post central gyrus. I'm repeating. Just remember these words: spinal cord. Now which column of spinal cord? Yes, that you have to read. But minimum. What is minimum? Spinal cord. From spinal cord, at least remember next step, that is medulla. After medulla, thalamus. Usually you can say ventral nucleus of thalamus, then internal capsule, and finally post central gyrus, DCML. I am again repeating, this is called as DCML, dorsal column medial lemniscus, dorsal column medial lemniscus pathway. Now what happens in stereognosis and astereognosis? Anyway, any abnormality in stereognosis leads to astereognosis, that I am going to describe, that is a bit serious, that is Alzheimer's syndrome. Now what happens in Alzheimer's syndrome? Of course, cause is unknown. Risk factors, genetic. Remember, there is difference between cause and risk factor. Cause is unknown, risk factor is genetic. I'm repeating, you have to write these things. Cause is unknown and risk factors are genetic. Now what happens here? Yes, there is a lack of memory. So what is affected? Memory. Commonly recent memory is affected. Then what is affected is abstract thinking. So memory, abstract thinking, planning, ये तीनों affect होता है. इसकी वजह से executive functions are affected. What I want to say, क्या क्या affect होता है? Memory affect होती है. Then abstract thinking, person can't think abstract. He's too close sometimes to reality. And planning, इसकी वजह से क्या affect होता है? Executive function. See, remember, whenever you are writing what happens in Alzheimer syndrome, or you are telling in Viva after living anatomy, examiner asks you, okay, what happens in Alzheimer syndrome? You have to be confident and tell in order. So what happens first is loss of memory. पहले क्या होता है? Memory loss होता है. फिर abstract thinking जाता है. फिर person planning भूल जाता है. He can't plan. Then what happens is the executive function loss. Remember, in any kind of disease, you must explain symptoms in proper sequence. I'm repeating again and again in this chapter. Neuroanatomy, the heart of neuroanatomy is sequence. Similarly, I told you the sequence of the tract, that is from medial lemniscus to cortex via what? That is medulla, thalamus, internal capsule. Again I am repeating, sequence. And again I am repeating the definition again, 2 words. That is, what is stereognosis? I have already shown you in demonstration what is stereognosis. मैंने object दिखा के आपको demonstration किया है. This is the purpose of anatomy teaching. It is a live teaching. So stereognosis, ability to perceive and recognize the object. And of course it is lost in Alzheimer's. Again Alzheimer के causes में आपको re-remind करना चाहता हूँ. What is re-remind? Yes, causes unknown, but risk factors are genetics. Causes are unknown, but risk factors are genetics. Thank you so much.